Hey guys, so my project is over multiple sclerosis by me, Carly. Um, I I've never met anyone with multiple sclerosis, but I know there's some celebrities out there that have been diagnosed with it, and it kind of intrigued me, so this was a good opportunity for me to dive into the rabbit hole and make a PowerPoint and learn something. So let's just jump right in. So, what is MS? Multiple sclerosis, MS for short, is a chronic disease that damages the central nervous system, including the brain, spinal cord, and optic nerves. MS is an autoimmune disease, meaning the body attacks itself by mistake. It damages the myelin sheath, which is the protective coating around the nerve cells. This also slows or blocks messages between the brain and body. Myelin is a protein and fatty substance that surrounds and protects nerve fibers. In MS, the immune system attacks the myelin, which becomes destroyed in many areas. This loss of myelin forms scar tissues called sclerosis. These areas are also called plaques or lesions when you're looking at them on like images or something. And when the nerves are damaged in this way, they can't conduct electrical impulses normally to and from the body. So, if we look at this picture here, the neuron on the left shows what a healthy myelin sheath looks like, and then the neuron on the right shows the multiple sclerosis. It looks like there's like bites that have been taken out of it, and it's really rough and rigid versus the one on the left is very smooth. So yeah, that's the sclerosis that I was just talking about. Alright, so the cause for MS is unknown, but it's thought to be a combination of like genetics and environmental factors. I did find where age typically, so MS can happen at any age, but it's most commonly happens between 20 and 40 years, which to me is, that's such a big gap anyways. That's, I don't know, seems a little bit of a stretch to me. But sex, women are 2 to 3 times more likely than men to have relapsing MS. If you have a family history, like your parents or siblings has had it, you're at a higher risk of developing the disease. Climate, this one was interesting to me too. It's more common in places with a temperate climate. So Canada, northern United States, New Zealand, southeastern Australia, Europe. And this one really intrigued me, obesity. So people who are obese or were obese in childhood have an increased risk of multiple sclerosis, which is crazy that, you could be healthier now, but as a child, you were considered obese, and like that could have set you up to have this disease. So MRI is the modality of choice when it comes to diagnosing MS. We all know that generally when you're doing brain scans, most of the time it's CT, but MRIs are preferred when scanning for MS because in the images, doctors are looking for abnormal white matter, and the MRI shows a very good depiction of the brain tissue compared to what CT would show. They often introduce gadolinium, an injected contrast dye, which helps to detect active white matter injury. MRI is highly sensitive and specific for detecting MS, like I said earlier, and it's a non-invasive way to obtain detailed images of the brain and spinal cord without radiation exposure, which is great. MRIs detect MS by the use of strong magnets to create high-resolution images, and they can be used to monitor the disease course and response to the therapy. So if you look at this picture at the bottom, it's labeled ABCD. In this picture, A is the baseline photo, and then B is 1 year, C is 2 years after, and then D is 3 years. If you look right here at these little white dots in A and how they get bigger and bigger and bigger throughout the pictures, that is your multiple sclerosis. And it also inflames these two little black areas in the brain too. I don't know if inflamed is the right word, but they also get enlarged as the multiple sclerosis grows. And then the picture up top, it doesn't show progression, it just shows the different images you get with MRI. So this first one's labeled flare. The T2 I think is the best one. I feel like it's a lot easier to see, especially compared to the T1 post contrast. And the DWI, that's not too bad. But I think the T2 is the best looking image from MRI. So for additional modalities, because there's not like a one test figures out what MS is, there's like a combinations of tests that can help confirm or rule out the diagnosis. So besides MRI, blood tests can help rule out other conditions that may have similar symptoms to MS, lumbar puncture or spinal tap. This test examines the cerebrospinal fluid for proteins and inflammatory cells associated with MS. There are also evoked potential tests, also known as EP tests. These tests measure how quickly the nervous system responds to stimulation. EPs can detect slowed nerve impulse conduction, which is a result of the myelin damage. And then MS is difficult to diagnose because of the wide range of symptoms. And I've listed a few here. And the symptoms are included, but definitely not limited to blurred or double vision, and that's because of the damage to the optic nerve, trouble walking and difficulty with balance, muscle weakness in the arms and legs, memory loss, bowel and bladder problems, tremor, pain, and loss of vision because of swelling in the optic nerve, and dizziness. And like I said before, these are literally very few of the symptoms that you can have, but they're all such a wide range, from memory loss to bowel and bladder problems to blurred vision and muscle weakness and dizziness. Like, there's so many things that all of that could be. So it's hard to diagnose it, and that's why the MRI is the modality of choice, because you can actually see it very well. So there's no cure for MS, but there are treatment options to help slow progression of the disease and manage symptoms. So you have corticosteroids, and these are used to help treat MS attacks. These medicines reduce nerve inflammation. Then you have ozanimod, and this is a once daily oral medicine that decreases the relapse rate of MS. And then there's also muscle relaxants. With MS, you might experience like muscle stiffness or spasms, particularly in your legs, and the muscle relaxants might help, get rid of the stiffness. But there's also a Botox treatment as like another option for controlling muscle contractions, which I thought that was interesting, because typically you think of Botox as like a luxury to get rid of wrinkles, but it actually has a medicinal purpose. So patient care, prognosis, and life with MS. People who are diagnosed with MS can lead full and active lives, even though the condition can be challenging. MS affects people differently, with some experiencing only a small impact on their daily lives, while others have more severe symptoms. Daily routines may become more difficult, and potentially including medication management into your life. or their life, physical therapy, lifestyle modifications might need to be made to maintain their quality of life. Um, you typically have fluctuating symptoms. So symptoms can come and go, meaning you might feel relatively well one day and experience significant challenges the next, depending on factors like stress, temperature, or physical exertion. You may also have fatigue, and this is just could be a part of your daily life now. Um, and this is often the most prominent symptom, causing tiredness even with minimal activity. Mobility challenges, difficulty walking, balance problems, muscle weakness in legs, and uh, muscle stiffness can impact movement and require assistive devices like canes or walkers in some cases. And that can be hard on people if you're used to doing things by yourself all the time, and then now you're having to depend on people or canes or walkers. That would be hard. And you might also need to find a support network. If once you are diagnosed with MS, you have a lot of doctor appointments and visits, and your life kind of becomes more about maintaining instead of fixing. So finding a good support network, connecting with family, friends, support groups can be invaluable for emotional and practical support, because having so many factors of your life change at once can be so stressful. I couldn't imagine. And may even at times feel isolating. So having a strong support system with you will help build morale and keep the patient from wanting to give up. And yeah, so that's it. Here's my works cited, and I hope you enjoyed and learned something. Thank you.